Okay, well, as we get started, want to introduce some requests, I guess you could say. This is a presentation on inventory management, getting your inventory safe, getting your practice safe, and making sure that you're following smart principles that Steve and Joey are going to take us through. And before they start, one of the asks that we have is for an interactive group. So please use the chat or the Q&A. I'll be moderating throughout this, the next, call it 55 minutes. So leverage that chat, leverage the Q&A, and I will make sure to get those requests into Joey and Steve when appropriate. So when there's a gap, when the right time presents itself, we'll make sure to get that question answered. So with that, I'm going to pass it over to Steve and Joey.
Great. Hello. This is Joey, and that's Steve. And Steve, I think we should probably do a really quick, like not the long introduction, but a really quick introduction of who we are.
Yeah.
I'll start. So my name is Joey Campagna. I've been in the animal health industry for 20 years officially this month. I started with IDEXX back in April of 2004. I was with that company for about a decade and a half, and then came over to Cubex in 2018. I started out in sales, and I've been in marketing ever since 2011. So I'm very excited to be sharing this presentation with you guys today. And yes, Steve is my little brother. Steve, take it away.
Yeah. Thanks, Joey. So I've been in animal health about 15 years now, formerly with IDEXX as well, and joining Cubex here to help practices really manage the thing that's very difficult, which is inventory and controlled drug usage. I'm a senior regional sales manager here and education specialist, making sure that practices like yourselves learn the best practices in the industry. So I'm happy to be here today with Joey and with all of you. So let's go for it.
And no, neither of our parents are veterinarians.
No. But my wife's a practice manager, which counts
right.
For all of you out there. All right. Thank you, Cynthia. I'll speak louder. Thank you so much.
Oh my gosh. You've unleashed a monster, Cynthia. So.
Yes. All right, get us started here, Joey. What are we talking about today?
So get safe and get smart is a catchy line that we derived from these two frameworks that we're going to address today that govern both the management of controlled substances and the overall management of inventory. So safe handling is an emerging set of standards around how to do what's best available when it comes to tracking, logging, and then securing controlled drugs, not just from a regulatory compliance standpoint, although that's important, but also from a practice health and workflow standpoint. So it's really about going above and beyond the bare minimum and reaching for what's aspirational, what's possible in the space to do the best for the practice staff, the community, and the pet. And then smart inventory is really kind of a similar concept, but for inventory writ large, using technology that has been around in the human space for about 20 years and really applying that to solve some of the problems that we see very commonly in inventory. And some of that has to do with trying to create more time in every day and every week for the human staff members in the practice with that automation.
Perfectly said, Joey. And I think we'll kick it off here thinking about that safe handling in particular, knowing that, look, we know that everybody has unique challenges in their animal hospital. Every single practice has a different group of people and circumstances. So everyone's unique, but at the same time, just like every dog that's unique, every breed that's unique, every dog's the same. We have a skeletal structure with a skull and same type of organ functions, right, that we monitor through blood work. So same is true for animal hospitals, where we try to look at those processes and apply best practices to them. Especially when it comes to controlled drugs and inventory. We know that the same drug, same inventory is about 90% similar between all different types of animal hospitals. So if it works for someone else, it might work for you. And if something bad is happening somewhere else, it might happen to you. And this is where we're starting with the gathering storm that we're talking about, the opioid epidemic that's been unfortunately in our news for many, many years here, where now veterinary practices are being targeted as places where people can find those drugs, divert those drugs, and unfortunately make some terrible choices in animal hospitals, and practices all over the country have some very sad stories about that happening each day. So if it's not happening where you are, please keep that in mind, that it could happen, but we really want to prevent that by building great protocols to prevent it, and be aware that your client base might be seeing this in the news and thinking, can it happen at my hospital? So let's build a framework to communicate to them that it probably shouldn't happen here because we're aware of it. How do we navigate those problems? Well, those problems affect us different ways depending on the practice that you might have. In some cases, we're spending a lot of time on inventory and, of course, the nursing part. Being a technician and a practice manager, there's so many different hats you all wear. So the idea that we're spending the time on all those important client and patient duties each day affects our ability to do those logs and keep up on inventory. And then also with that time shortage, boy, we miss some charges here and there. And that's really not through anyone's fault, except for, all the work that they have on their desk at the same time. And when there's room, when there's gaps, unfortunately, nefarious members of the veterinary field find those gaps and divert drugs. So that leaves room when there's not policies in place that prevent that. So really navigating that environment is tough to do, to balance all those priorities. We understand that. So what do we do? Well, we can turn to the AVMA, and we can find that they've recommended we take some time to educate ourselves like you all are doing today. We really want to find protocols that focus on the security of those drugs and place an emphasis on identifying and preventing that human misuse, right? So think of it from a standpoint of, if someone were to try to take these drugs from us, how would they do it, right? And that's an uncomfortable place to put yourself if you're an honest person. But let's think about those gaps in our security and try to close them with something like safe handling. Well, the human field had this happen, right? They had this focus about almost 30 years ago now. They saw an increase in diversion and mistakes, really the wrong doses, getting to the wrong patients in human medicine caused a lot of problems with, of course, human healthcare. So they automated, they turned to technology. And in 2008, Cubex brought that technology to the veterinary field, and many other companies have done that since. So finding a way to get the right drug to the right patient at the right time through the right pathway and the right dose. That is the gold standard here, is making sure that we have a protocol, a path to follow. And automated dispensing creates that step-by-step set of directions, so you don't have to be there to enforce it as a practice leader.
And so, as we all know, the human healthcare industry in America doesn't do much if it's not profitable. So usually, the idea that automation is profitable is something that is readily accepted. However, there's also a fairly robust body of research that shows it also leads to better patient outcomes via higher dosing accuracy. So these kinds of systems in human hospitals have been documented through peer-reviewed studies to reduce dosing errors and to reduce time between a drug order and the administration of that drug because of the increased efficiency. So there's also a clinical care component to safe handling and, more broadly, smart inventory.
Yeah, you'll hear this a lot, everybody, that we have so many hospitals that have found multiple reasons to become safer. It's not just one reason. And if you just take one step in the right direction, you're getting closer. And this is an example of the thousands of hospitals. I'm in the Northeast of the United States here, and so many hospitals have done one thing, maybe not all the things they could do, but that's better than they could have done yesterday. And that's what you're doing today. So it's not all or nothing. It's not just Cubex. It's not just the other options that are out there. Just do something better to automate this process, and you'll be on that side of getting better.
Exactly. These are veterinary hospitals, by the way. We should clarify. These are not human hospitals. All of the
Yep.
dots on this map are veterinary practices that are enrolled in the safe handling program.
What are those core elements of safe handling? So what's involved in getting safer with safe handling? So think of it like fear-free in a way, right? Where we're saying, here are some things you can do, objectives, tasks, and goals to say, if I do this, I will become safer. Where biometric access. So there are many different options out there for different safes where you either have a key card or a fingerprint to be able to access those drugs. Single item control. Knowing that you're getting the exact drug you need for that exact patient, right? And not having access to everything. How many times do we see a lockbox open and I can take whatever I want if no one's looking, right? We want single item control, and witness requirements are a unique feature of only a few different systems out there where you can have a person required with you, and that really limits the possibility for someone doing the wrong thing, even if they mean well, just making a mistake, right? Having another set of eyes there. So there's multiple different facets for this. There's actually a few more that aren't listed here around mental health, including Not One More Vets, Safe Harbor initiative,
Lifeboat.
and Lifeboat. Thank you, Lifeboat and Clear, which is one of their programs that you can go to. Not One More Vet, who's a partner, along with AHA, who partnered with us, because we have to work together to fight the real threat to our industry, which is veterinary staff and veterinarian suicide that's prevalent in our industry. And if we don't acknowledge it and talk about it, we're not doing that. All the folks that are affected by it, the best service we can. So safe handling comes with a big picture view of making your industry safer, but how do we do it? It also comes with instructions. So let's talk about ways to implement this, because oftentimes these programs and technologies come with a cost. So how does the practice afford that, right? It's very expensive. Well, actually, it's not. It's not. And I see Desiree, your question in the chat. Let's talk about that before I get into this. Witness requirement makes it so somebody is there to verify dosing too, which is impossible to get people to do double checks on injectables before we got a Cubex. I love that comment, Desiree. Thank you. If you design a protocol where someone has to be there to get something out of something, right, you ensure that it's going to happen, right? We're going to control the things we can control. Right. And that's a great point. Double, triple checking things. Hey, if it was my patient or if it was me as a patient, I would want that done. Right. Thank you, Desiree. But Cubex can be expensive. All these systems can be expensive if you don't have a plan. So this next slide talks about that plan. Safe handling says, if we believe this is best for the practice, let's communicate that to our clients. Let's ask them to support it, whether it's per transaction or per procedure or per invoice, meaning everyone that gets an invoice. We can design a fee that you can charge in the cost of the drug, so it's behind the scenes, or as a line item, kind of like a medical waste fee. And that can communicate to your clients that we value being safe here. You can do all of these, in fact. I have hospitals that do per procedure, maybe $5 more, per invoice, maybe $1 more. We do some math, we figure it out together, and they implement it so that it's not a cost impact, it's more of a value impact on their bottom line and their efficiency. Here's some examples. These are practices that came to Cubex and they said, here are all the different numbers, meaning how many controlled drug usages they had per month, how many procedures they did per month, and how many visits they had. And we just did some math together. And we said, here's some of options for you. In many cases, they opted for a combination of these fees, or the bottom one, which is my favorite, to say, hey, everyone that walks into our hospital is safer. So let's spread this cost over every single client that walks in the door, and it's just around $1. So it doesn't seem so intimidating. No matter what the cost is for your system, your practice's volume scales with the size of the solution in many cases.
Hey, Steve, the dental looks great. I mean, my dog's teeth are whiter than I can ever remember them being, maybe since he was a puppy. What's this $32.14 for safe handling on my $640 invoice? What's the $32?
So part of our job here is obviously making the pet healthy and making sure we do a great dental. The other responsibility we have is to house and log for the government controlled drugs that were used during that procedure, right? So we want to make sure we do that the best possible way we can, following the gold standard protocols. So this is a safe handling fee that involves some fees we pay to control those drugs, to store those drugs, and make sure that it's done to protect our community, make sure your patient, your pet, gets the correct dosage, and our staff is protected as well. We want to make sure that that's safeguarded, and we value that here. Is that okay?
Okay, great. So you guys use those drugs to put them to sleep? Those drugs?
Yeah, those drugs we put him to sleep.
Or
Yeah,
to I'm sorry, to anesthetize him?
yeah,
Yes.
put him to sleep, anesthetize. Yep. In
Yep.
either case, we want to wake him up, right? That's important, Joey.
Yeah.
This is part of the fun Joey and Steve banter you get here, is us joking around and
So
making mistakes.
that's just an example of, how you would talk through that question that you might get from a client, when you're talking about these kinds of fees. That will maybe happen every 6.5 weeks. Kind of, it's not a common
it's not that
thing.
often. Right.
But there are brochures that will provide you with in order to help train that. And again, especially for the per patient invoice, 63 cents. That's not a super high bar that you need to clear.
A lot of times we're gaining a lot of time back with this and making sure we're doing it right. So there's other things we'll talk about later in the presentation that add to the value of this, but this offsets the hard cost, which is the first barrier for a lot of folks is saying, geez, how am I going to pay for this? We have a plan.
Okay, great. Is this the part where I take over?
Yep.
Okay. Super. One last thing to mention about safe handling and smart inventory as well. Cubex is not the only game in town with these protocols. So we're both Cubex employees. We make no bones about that. And when I came to Cubex in 2018 and looked around the floor at the VMX trade show, there wasn't anybody else who was talking about this kind of stuff, about how to better secure and manage controlled drugs. In 2024, that's no longer the case. There are other companies out there that are trying to innovate in this space. And while I can confidently say that none of them do everything that Cubex does the way Cubex does it, there are options out there today. And so we've really gotten behind this initiative to get the conversation started, because we know that once customers start to investigate this space within their practice, if they decide they really want to do what's possible, a lot of them are going to find Cubex. Some won't. Some will go in a different direction, and that's okay. We really welcome the competition, but it's the conversation that's the important part and getting that process started. So if you guys all start Googling, Cubex competitor at the end of this, that's no problem. That's great. Go out and learn. We'll be here, and we'd love to share with you what we can do if that's something you're interested in. So getting safe is but one part of the whole picture. In fact, if we think about getting safe as part of getting smart, it's exactly 25%, because there are 3 other steps that we need to talk about. And no, this totally doesn't look like the Simon game that some of you guys may have played as children or play with your kids, or maybe you're adults and just like to play Simon. So we're going to go through each one of these steps one at a time and talk through the get smart part of the process, because getting smart, there's a little bit more to it than getting safe. So at the end of the day, what we're trying to drive at with smart inventory is a 2 to 4% reduction in COGS. And just to be clear, that means we're going from 28% down to 26%, or maybe even 24%. Now, if you're like COGS, like the cog in a wheel, COGS stands for cost of goods sold. And it's a measure of how much of each dollar that comes in do you have to pay for stuff. And a COGS of 28% means that 28 cents out of every dollar of revenue has to go back out the door to pay for all the stuff. The lower that number is, the better, right? And what we at Cubex do, and really what smart inventory, regardless of who you use, is supposed to do, is reduce your COGS. So we could say, instead of 2 to 4%, because sometimes it gets a little confusing, it's like percentages of percentages are a guaranteed way to get people spinning in circles. 200 to 400 basis points is another way to think of it. But again, we want to reduce that by a substantial amount so that you really can feel that improvement in cash flow. So step 1 to getting smart, getting organized with high density storage. So Steve has made me watch The Home Edit on Netflix. And I like to think of the first step here as kind of being like that, right? Like we're going to show up at your practice. Literally, we're going to have two of our inventory experts show up at your practice, and we're going to do a total inventory makeover. And a lot of that is getting all the stuff that you have out. So we're going to pull it out of the little cubby holes and all the nooks and crannies that it's stuck in right now. And we're going to take it out, and we're going to figure out what's going to stay and what's going to go. There's often too much, but whatever we keep, we're going to make sure it's very accessible, right? Because when we look into those nooks and crannies, what we see is a high cost and a high risk business within a business. Your inventory is absolutely that. All of this stuff is expensive, and you guys resell it, right? So it's kind of a small part of your business that's a business in its own right. And when you're managing it manually, boy, it eats up those closets, right? And all those extra rooms. It also eats up your time, and it eats up your cash, because every box that you see on those shelves is like a stack of maybe $100 bills, maybe 20s, depends on what it is, right? But it's like a stack of money. And the longer that box stays on the shelf before it gets sold, the longer your money is kind of frozen there instead of doing something more interesting. There's also risk, right? There's diversion risk from the DEA. There's risk of missed revenue because people are human and sometimes they make mistakes. There's misuse risk. You're going to use too much of one thing and not enough of another. And then there's, of course, the risk of shrinkage, the 5-finger discount, right? And yeah, that does happen. So we're going to move from that kind of a system into high density storage, where we take your inventory and we basically, with the smart inventory system, whoever you use, you're going to put it into the equivalent of skyscrapers for inventory. So these systems have much more depth than a traditional shelf, and they also use removable storage containers that have room for multiple SKUs within a single facing. So you can take one of these containers out and get access to 3, 4, 5, 6, 7 different SKUs just in that 1 4-inch area of frontage. It's an absolute revelation.
How do I find my stuff? Because I'm used to seeing it all like in one glance, everything at the front of the shelf, right? So how do I find it?
It's a great question. So the system is actually going to direct you to, first of all, the system is going to pop a door open, and you can see this individual is reaching into an open door. There are lots of other doors on the system that stay locked. So the door is going to pop open, and it's going to direct you to a bin number. You can also see the labels on each one of the bins, say bin 11, bin 12, bin 13, etc. And then finally, it'll direct you to a segment number. So the door will pop and it'll say, go to bin 8, segment 2. You'll take bin 8 out, and the second segment is what you're looking for. Does that make sense, everybody? Okay. If it doesn't, just pop a comment in there.
I think any hesitancy here around, boy, that wouldn't work in my hospital, is usually around, we've been doing it a certain way for a very long time that's worked for us. But the reality is you've also accepted all those gaps in efficiency and potential for having stuff on the cabinets, on the counters that you're not using. And just in case we run out of it, well, let's have extra. This is a new world of thinking, of saying, you know what, let's reclaim some of that. Let's reclaim some of that space and that money.
Yeah, that's a great point, Stephen. And I think, at least at Cubex, we hear a lot of that'll never works, right? And Valerie brought one up at the beginning of the session, right? Like we thought we could never actually do a witness verification until you do it. And the metaphor I always use for this is, if you think about it, there's about 47 different ways to make a peanut butter and jelly sandwich, right? You take the bread out first, or do you take the peanut butter out first? And then what goes on the bread first? Jelly first, or, I'm a peanut butter first kind of a guy, right? And, with Cubex, there's probably like 12 ways to make the peanut butter and jelly sandwich. So you might need to change a couple things, but you're still going to get the peanut butter and jelly sandwich at the end, we promise, right? It just might need to change a little bit, but you're going to get there.
You're never going to run out of bread, peanut butter, or jelly.
That's the bigger point, right? Because a smart inventory system, whether it's Cubex or another one that can do automated replenishment, you're going to have these stocks replenished for you before you even know they're low, usually. And
And
that
I'll just
takes us to
acknowledge
step 2.
real quick,
Yep.
Joey, Natasha acknowledging that change is scary. It just takes some learning and time to get used to it. Love that comment. It's the truth. If you want things to get better, it takes some period of time of change. But Jody also just upgraded to Flex. So now they have more of their inventory in Cubex and they think there's so much more space. Thank you, Jody. And it's easier to do inventory control. It's like on the other side of it, once you get through that change, boy, are you happy. So getting automated to that rev up revenue is the next step here. And part of that is, looking at the way this works. So how does it work where we're going to save revenue, Joey?
And I'm going to swear on Grandma Joe. These are not plants, guys. These are actual cups. Like There's totally great comments there. So how does smart inventory increase revenue? Again, guys, this is whatever smart inventory system that you're looking at, you need to have a charge capture mentality. You need to ask that question, right? How is this going to improve my charge capture? Because this is a huge gap in practices. And I go back to that first slide. Every practice is unique, but every practice is the same. How many of you have heard a pet owner say, oh, well, my dog would never blah, 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 right? We've heard many times throughout my entire 20-year career, oh, like in our practice, we don't see Lyme disease. It's probably because you're not testing for it, right? In our practice, we don't have missed charges. It's probably because they're being missed, right? It's the same. If you don't test for a disease, you're not going to find it. And if you don't have an automated system, you're not going to find those missed charges. Now, with Cubex specifically, we've done case studies. We've got this very well documented. About 15 to 20% is what we see in terms of the increase in revenue for every automated SKU in the system. So every SKU that winds up being managed by Cubex relative to before Cubex, we see about a 15 to 20% jump in revenue. Why is that? Because we're finally charging for every dose. We were missing a whole bunch before. That's on average. Sometimes it's a lot more, as we'll see, sometimes it's less. And there's also a labor efficiency aspect to this, right, Steve?
Absolutely. I mean,
Steve, are you furiously typing a response to a question?
I was. I really appreciated Jody offering her time to answer questions because let's face it, she's been through transition from before Cubex and after. So I believe what she says just as much, if not more, than what Joey and I are saying. So reach out to her at the email address. But the labor efficiency is huge here, right? We're always trying to hire in veterinary hospitals, right? We want to find the more people because our best people, even, those best people need help. So what we want to do is get more out of those best people we have. Oftentimes the most trusted individuals at the hospital, right, are doing the inventory and controlled drug logs, those with the most on their plate. So if we can save them time, our Jodys, our Natashas, if we can save them an hour here and there, boy, that makes a lot of difference in the flow of a day because they can manage the day better. So we can automate some of those tasks. We can also measure, right? We can measure how much time they're spending before and after, and we've seen that improvement as well.
So, I'll mention another safe handling provider, VetSnap. So they've got in their software a very nice discrepancy resolution function, which is a great time saver versus manual discrepancy resolution. I mean, I know Cubex has that. Other manufacturers have that as well. So comparing an automated system like that just for resolving discrepancies in a clean and easily retrievable way is night and day between that automated system and a manual system in a lot of different aspects when it comes to labor efficiency. So this is a very simple graphic, but it's one that we that we put in to this talk because it helps level set everybody on this cost of goods sold question and issue, which is how exactly do you reduce cost of goods sold? So this is a gross oversimplification, but remember that COGS is a percentage of revenue. So the blue bar on the left, that's the dollar coming in. And then the gray section there is the COGS that we pay out. And again, this is a really oversimplified, but you can think of the rest as going to EBITDA, as going to essentially profit. That's earnings before interest, taxes, depreciation, and amortization, but you can think of it as profit. So if we want to decrease cost of goods sold. Remember, it's a percentage. There are a couple ways we can do that. One is that we can increase the revenue. So instead of $1, we can bring in $1.10 or $1.15. And then we can also reduce the amount of cost that we have in absolute terms. So we can go from 28 cents down to 25 cents. Or, and this is the tricky part, even if we keep it the same in terms of the absolute cost, but we grow the revenue, the percentage will decrease, right? Because 28 cents is a smaller percentage of $1.15 than it is of $1. So sometimes we're able to affect a COGS reduction just by keeping the dollar amount the same, but we recover so much revenue. We increase revenue so much that the COGS drops way down. And
Sure.
The reason I mention that is sometimes it's hard for practices to understand, well, why would I start using less stuff if I have Cubex? And there are answers to that, because you actually will use less stuff with a smart inventory system. But even if you didn't, the revenue going up will decrease COGS.
And I think many practice leaders are challenged now that their schedules are constantly full, right? After the pandemic, we saw that, look, every slot's full. How do we grow the practice without hiring more doctors and opening up more appointment slots, or growing the practice physically, adding exam rooms? Well, it's getting more out of the business that you're currently doing, right? And this is the way to do that, is become more efficient, right? And in many ways, waste is one of those very tough things to nail down. And Caleb brought up a great question, because there's some ambulatory practices out there, whether they're large animal or small animal. And how do we help with safe handling if we're out on the road? And that's tricky, Caleb. So I'll say this, making sure we know what's on the truck and what it's used on, having those logs that are paper logs on the truck, it's great. I think having a home base for the drugs and dispensing those drugs out on smaller quantities using Cubex or another system at the main location, right? That really helps as well, because then we can track better, what quantities were taken out and have them secured. And if you can take them off the truck in each night, that's great. That's best practices. Although I will say, again, another plug for VetSnap. They have an app that works great on the trucks. You can use that in combination with Cubex, at the home base, at the main practice.
We have practices that literally do that.
Yeah. And that's a great solution. It really is. So, Caleb, happy to talk to you about how that Cubex side works. But as Joey was saying here, we got to watch the numbers, right? If we really want to see how cost of goods can get affected, we have to look at them first, right? So many hospitals I work with will be kind enough to share with me their cost of goods and their income. And then we can actually get a feel for this. So this practice said, I think we're doing pretty good, Steve. Can you take a look for us? And they had it nicely line itemed out there on what they're making money on and what they're spending money on. And as you can see on the left, this is their income. On the right, there's their cost of goods. And I said, let's focus on the stuff that Cubex can control, right? Your inventory. And geez, pharmacy, flea and tick, okay, heartworm. We can put all that in Cubex and charge capture it. So I wonder how they're doing here. So if I did the math, they thought their cost of goods was around 28%, looking at their overall revenue, when in reality, it wasn't. If we focus on just the pharmacy part of it, it was closer to 55% of cost of goods, which is just not what they expected, right? We looked at it and we said, oh boy, we're growing, right? 2022 to 2023, they grew substantially in the pharmacy revenue. So we have to do a better job of it. If we keep growing, we're losing more money, right? Our problem's getting bigger as we're getting bigger, right? So if we dialed it in even further, and I looked at flea and tick and heartworm and took those out, just pharmacy, only a 6% profit in their pharmacy. So that spoke to a lot of mischarges, maybe some waste, maybe some theft. So this was something that I think the owner of the practice was not aware of. He was, but he wasn't, right? Until you look at the numbers. So my encouragement to all of you is to look at those numbers with someone like myself, right? We look at these numbers all day long. We're happy to look at profit and loss statements and sign NDAs to look at those. This was not a case where the practice asked us to sign them. In fact, the practice said, please share this with people. Boy, this is an eye-opener for us. So please measure something if you want it to get better.
Right. And that brings us to step 3, getting secure to stop waste and misbehavior. So waste, guys, it's going to happen. Entropy is unstoppable, right? But it's probably costing you 1.5% to 2.5, 2.5% of revenue. And this is expiration, misdosing, misplacement. I'm sure most of the folks on the call have lost a half-empty bottle of a something, reordered it, and then found the half-empty bottle a couple weeks later in a place it didn't belong, right? That's kind of part of life. With a smart inventory system, you should have a plan for every part, and the vendor should build this with you, right? So at Cubex, this is what a plan for every part looks like. We categorize items by priority, and we really look at classes of items, and then we go down to specific items. So you can see a class such as antibiotics or cardio drugs, and we figure out what level of security that drug is going to need based on risk and also the overall prioritization, and then we figure out the right platform to put them in. It's a critical part of the pre-implementation process for a smart inventory system. And this is unfortunate, but the social normalization of theft is causing a lot of retailers to have to look at smart inventory systems, or in a lot of cases, not so smart inventory systems that require somebody to come over and put a key in to open it up so you can get some toothpaste. But these aren't going away. And the reason that they're up is that sometimes your own employees can be a shrink risk. And that doesn't mean they're bad people, but it's just kind of human nature at work. Locks help keep honest people honest. And if there's not a big tempting pile of Simparica sitting there where someone could think, no one's going to miss a couple boxes if I throw them in my bag, then you're going to retain more inventory than it would if everything's just kind of sitting out in the open.
And maybe it's as simple as, we sent home the wrong dose. They'll come back and pick up the correct one. They forgot it at home. Don't worry about it, right? We'll deal with that loss. Not a big deal, right? But that adds up.
So we're going to get into okay, what does this really mean part of the presentation now. So if we look at sort of dollar amounts and amounts of time that we can look to reap from a true safe handling and smart inventory system, you can see some of the numbers here: 5 to 7 hours a week, about 30% or more of treatment related revenue recovery. Treatment is really the worst place for missed revenue, because that's
all those injectables.
Yeah,
they add up. They really do.
Emergent cases. Exactly. And then loss prevention. This is a really tough thing to measure, but based on surveys we've gotten, it's about 15% for loss reduction. That includes expiration, misuse, et cetera. Again, getting a 2.4% of COGS. So this is a group that we looked at, a multi-practice case study. These are practices that are all over the map. And we wanted to look at, just how big of an effect was this for each one of these practices. And so we first looked at labor savings, average amount of time saved per month with DEA written logs versus hours gained. So, if we look at, Sycamore, that's 30 hours per month that we're gaining just for that one practice. And as you'll see, that's not a huge practice. Right. I think the average that you can expect, again, 5 to 7 hours a week per DVM at a practice. So Sycamore is four DVMs, I believe. And this is a very interesting look at this, because it's not always linear like that. I just described it. So some practices have more stringent manual protocols than others. And for those practices, they're going to reap a much higher time benefit from an automated system. Another way to put this is that there are generally two options. Either you're doing this poorly, or you're doing it well and you're throwing a lot of time at it. And in either case, there's going to be a dividend that an automated system is going to provide you. And Sycamore, again, is interesting here in that 62 hours are coming back to that practice just from written DEA logs. They had a triple check system in place that the practice manager implemented. The practice manager, by the way, shortly after the study, was hired up at corporate to become the compliance manager for all 140 practices in the group. She was really good. So they gained 71 hours a month of time. And that's important to remember for later. So let's look at an example. So this is practice A. It's Willamette. up in Oregon. And we start with these three numbers. These are really the three keystone numbers, because from before Cubex to after Cubex, we need a common denominator. How do we normalize all these revenue numbers based on the ebbs and flows of the business? Well, we look at patient visits, because if you see more patients, generally revenue is going to go up. If you see less, then generally revenue is going to go down from one time period to another. So in the 60 days that we looked at, we did 60 days pre, 60 days post. We saw a 7% decrease in patient visits, makes sense. 5% decrease in all other revenue, makes sense. But a 25% increase in revenue for the Cubex managed products. How does that happen? What explains that? That's $12,487 of revenue that's directly attributable to a smart inventory system. And you can see this breakdown here. How did that happen? The Occam's razor explanation is that before Cubex, you were giving a lot of stuff away. And once those SKUs wound up in the smart inventory system, every dose wound up on an invoice because of the bidirectional integration that's present in that system. So just to be clear, when a dose is dispensed from a smart inventory system that's integrated with your practice management system, the charge is automatically going to be put on the invoice, whether you ordered it in the PIM system or not. You can go straight to the automated dispensing cabinet and get the drug out, and the smart inventory system is going to take care of the rest. It'll put it right on the bill. You can't miss a charge. The same way that your blood machine, whenever that runs a blood profile, is going to invoice that client. There's no more giving away chem CBCs. 20 years ago, when I started calling on veterinarians, they were giving away a lot of chem CBCs.
Or we were spending a lot of time tracking down, wait, which blood sample was this, and what did this go out? Did this get on the bill? We spent a lot of time managing those diagnostics. And to make another diagnostic allusion here, this is the test that you don't have right now for your business, right? You're missing this disease that's in your practice right now. So if you have visibility on it and a protocol around finding it, you will find the disease. It's there in prevalence that you don't like, I'm sure.
Yeah, this is not like, should we get a new chemistry analyzer that's a little bit better and has a couple more things? This is like, should we get an in-house lab? Should we get a digital x-ray system, or really an x-ray system? You know, this is an
x-ray system,
a whole new category.
Great way to look at it.
This is a spotlight SKU. So this is again from Willamette. This was really interesting to us on Dansteron, to the tune of $2,000 a month. I'm sorry, $2,000 for the study period. So about $1,000 a month in new revenue, 53% increase. They were giving a lot away. And I don't know clinically enough about this drug to tell you exactly why that is, but we know it happened because we measured it. This is the next practice that we looked at. This is a practice in upstate New York. This is Hurley Animal Hospital. Again, 3% increase in practice visits, 4% decrease. That's within the margin of error, but 15% increase in revenue from practice managed products. So $3,700 directly attributable to a smart inventory system, right? Again, those, yes, Steve?
The last practice was a 9-doctor hospital, bigger practice, right? This wouldn't work for smaller hospitals, right? This wouldn't happen at. No, do these systems go in smaller hospitals?
It's kind of just the same. It scales.
It's scale,
right? So you'll find that you know there are small practices that'll have that huge return because they're kind of a mess, and that's okay, because you know this is about cleaning up a mess. There are big practices that will have a smaller return because they're throwing a lot of human labor at this. And when when the human labor gets freed up, that's able to be allocated to other areas of the practice. But it's always the same. Again, every practice is unique, but every practice is the same. Here at this practice, it was Apoquil that was the lead SKU. And again, you know, in the pharmacy, generally there's less risk for mischarges because you're printing labels, and that's a check on lost revenue. But there's the dividend again, you know, $1,500 over 2 months. Just for one SKU, 38% increase in revenue from Apoquil during this period. So this is Sycamore, and I love this practice because it's the exception that proves the rule. So in this practice, we saw it was basically close to flat. Yes, we did have a slightly smaller decrease in revenue than overall revenue. 1% is smaller than 4%. But this is the practice that got 71 hours back per month from automation. Again, they had a very stringent triple check manual system that worked pretty well. It was just really time intensive. So,
and what is the value of that 1 hour? Right? That 1 hour of a technician is not just the pay you're paying them, it's the revenue they can bring in by taking 2 tech visits or helping to decrease the load on others there that are dealing with a busy day, right? There's other benefits that add much more revenue than even Cubex can. And I want to acknowledge Desiree's comment here. I work in a 1.5 doctor practice. We have gotten our COGS down to 20%, gold standard.
wow.
Under 20%
GP? Are you a GP?
1.5
That's
doctor
really
practice.
impressive.
Yeah. Cubex has made a huge difference in preventing expiring meds and missed charges. So thank you, Desiree, for, again, showing that this does work, not us saying it. And the aggregate of those studies, Joey, was consistent, right?
Exactly. So that's what we see here, everyone. I mean, this is a table that breaks down all those results. And again, you can see, more or less, it's about $700 per month per DVM. That can go in and out, but some it's actually more, like $800. If we take Sycamore out, it's quite a bit more. But we've never seen a negative case study, at least at Cubex. Maybe other smart inventory providers have done those. We haven't seen those because you're going from nothing to something. You're going from pen and paper to some kind of technology. It's much different than an incremental upgrade from DR is better than CR, right, Steve? No question. Those of you guys have gone from CR with the plates where you remove it, put it in the reader, to a digital X-ray system where it's built right into the totally better. But that's an incremental upgrade. This is like nothing to something if you're manually managing this. So Steve, let's talk about next steps.
Yeah, so the first step here really is to acknowledge that I want to start, right? It's not even on this chart. So if you think that you want to start, let's build a plan. Let's talk about what that plan could look like. And that what's involved in that plan is really just looking at your existing inventory, looking at your existing profit and loss statement. Let's build that plan before we make any decisions to do anything. Let's build a plan and then decide that we need to build a budget around that plan. So that's part of it, right? And saying like, okay, well, what is the upside here if we automate inventory? And we can help you do some math with some industry standards. We've seen the before and afters, right? We have some calculators and tools to help predict that going forward. And then we help you make it happen. And other companies will too, right? They implement those and then you check your work. We measure. And as Desiree said, you can measure this stuff. It's dollars, right? As opposed to something that's tough to measure, which is time. Time is actually really tough to measure. But I think your staff can give you that input after the fact, right? And saying, is your job easier? Yes or no? And the fact is 99% of Cubex practices renew their Cubexes at the end of their agreements. So that says they don't want to let it go. They don't want to go back to paper. They don't want to go back to counting things on clipboards. So that's checking your work as far as I'm concerned. But just know that you have both either at this company or any other company that helps with inventory. You have a lot of people in the industry who want to help. Okay, this is something that people can walk that road with you. And if you have a willing staff, I'd say that's the number one step here is just to be open-minded about it. And joining this webinar today says you are.
Absolutely. And again, our priority here at Cubex is the safety and financial health of the industry. That's why we're telling you, go learn about this, see what's out there, explore. You know where to find Cubex, but you've got to get into this space if you care about improving the safety and practice health for your specific veterinary hospital. We know that, sometimes we might not be the right answer at Cubex. That's fine. But figure something out for your practice to get closer to that ideal safe handling standard and to get your inventory smarter, because there just aren't enough people in this profession to address all the demand that's out there. We're hopeful that we can do our part to get more healthcare out there to all of our veterinary patients, dogs, cats. I was going to start naming species, but I'll come up short. We just got a budgie at our house earlier this week, an English budgie.
I didn't know that.
He's got,
That's
yes. Monty is his name.
Oh, cool.
So, do we have any questions?
Yeah, let's open up the floor here. I don't know if Michael, if we have the way to do that, or we can use the chat to do that. Love to answer some questions. And actually, I don't know if we have a way to kind of put up a slide of how to contact us. Michael, if we don't have that, that's okay. I can always put it in the
We
chat.
totally don't have that.
That's okay. I'm going to put my email in the chat, or Michael, if you want to man that, whatever the appropriate way for them to contact us is. But any questions out there around how this works, or anything we presented today?
Is this
Eldon, I see that your question isn't working. Want to put it in the chat? I just don't see it in the Q&A.
I get it. I saw one. Do we get CE credit for this presentation? Michael, the answer is yes, right?
Yep.
Um,
The certificate will be emailed out within 24 hours.
That's what I was going to ask. I'm sure that was the follow-on question. So Cynthia asks, how long does it take to implement?
Sure. So I'll handle that. Really, there's just a number of steps we have to go through, and the faster we go through those steps, we just have to build a database of what's going in the Cubex. We give you a spreadsheet, and we work on that together. Generally, that can happen in a couple weeks. And then we do custom build and order every cabinet. So that can take some time to get it assembled and shipped out on a freight truck, because they're kind of big. So I'd set the expectation around 2 to 3 months to make sure that I set low expectations and we over deliver. But I think with an engaged practice, we can certainly do it in 60 to 90 days. And that's an appropriate amount of time to absorb that change. So I think contacting us, the sooner the better, I'd say.
I love all these questions. Okay, so
Great.
The first one I'm going to answer because it's short. How much is Cubex? I'm so sorry if I missed this. That's a little bit of like a how long is a piece of string question, or Steve has the best one for this. Steve, go ahead. How much is surgery, right?
Oh yeah, right. So it's like a client calling you up and saying, "Hey, my dog's sick. How much is surgery?" And you say, "Well, what's wrong with your dog? I can't tell you what surgery. I don't know what we have to do, right?" So we need to evaluate how much stuff we have to put into a Cubex, because it is based on which cabinets you get and the type of training you get. There's a few variables there, but in many cases, we can meet just 2 times. A first time to talk about what's going into the Cubex, and we design a system that second meeting.
It's
so within
in
a
the
week,
hundreds of
out.
dollars per month usually.
Yes, right. And there's
that.
no upfront cost. Very important to mention that, Joey. There's no upfront cost here. It's a monthly subscription rate, and it stays the same for the whole term of the subscription. So no price increases, which is great. Lots of questions. Let's get to some of these.
Dr. Shukin, Shepherd integration. That's a bingo. That's a yes. Okay.
I got one for you, Joey.
Okay.
Or Steve. How does Cubex prevent short-dated medications and expiration?
Steve, yeah, so we have a number of reports that we can automate notifications on to say, hey, these are slow-moving products, or worse yet, nearly expiring products, upcoming expiring products. Because when a product comes into the Cubex, if, for instance, you use integration with Vetcove or a distributor, it'll send that expiration date over with it and the pricing. Super cool, right? So now I know when that product comes into the practice, when it's going to expire, and then it can notify me so that I can make changes with that product and talk to my staff about making sure the correct one gets used. So yes, we can certainly help with those, decreasing them.
That's great. Okay, we live in South Florida. Hurricanes are very common. What tips can you give on losing power for longer periods of time than the backup battery can handle?
Yeah, so great question. So if it's one of our supply cabinets that have the glass front doors, very easy. We give you some keys. You open up the top of the cabinet with those keys, and you can essentially unlock all of those glass doors. So for the majority of your inventory, you can get access in just a couple minutes. When it's controlled drugs, we want to be a little more careful with those. So we have another process where you're going to take a couple extra steps to make sure you get access to that correctly. But we can train you how to do that, and you will know if someone got access to those items. We want you to know that occurred because it's controlled drugs. So that's why
in instances like that, we have to replace a couple of parts, but we do that at no charge. That's let's see. I heard you say VetSnap works with Cubex. Are there good reviews with this? We have to leave that to you. We don't want to talk about our competitors' capability or anything. We can get in trouble for that. We do know I've seen that there are practices, especially mobile practices, that try to use both together. But
and because I made the comment, I'll clarify. It's not that they work together, right? It's like like using a hematology analyzer from one company and a chemistry one from another, right? They're going to do different things, but you'll be able to take that information together, right? And exactly. But compliments to them. What else
Is
do we
there a
have
way
here?
to get medications quickly? For instance, for a seizing patient, this is our number one question usually.
Yes, number one question. So I'm into that cabinet without entering any patient information, just very quickly entering, ABC for pet name in under 10 seconds and getting that out if I'm comfortable doing it. What I give advice to my practice is I say, let's leave those seizure meds in the old lockbox until we get comfortable and trusting Cubex for the first maybe couple months, right? And then once you're good at getting into the Cubex, you can put them in there, but you can always maintain a separate crash card if you'd like outside of Cubex and have separate logs. That's totally cool. But I think, look, we have a lot of emergency hospitals that trust Cubex. Okay, that's one of our best segments of our industry that uses Cubex because we know for sure in those moments where you're focused on pet care, you don't want to be focused on logging, right? And making sure you get the details right in that aspect.
Norma, do you have any staff training resources to help refresh some of the staff and getting them more comfortable with things like controlled drug countbacks, et cetera? So yes, we do have well, it's really a service called Cubex Academy, where you can go and watch videos on little snippets on all of those common functions. And we're happy to get you the login that you would need for that. Just let us know. We also have a new service called Cubex Coach, which for some practices is no charge for the first year that you can enroll in, where we actually have somebody that can come out to the practice and do some on-site training. So we can get you connected there. Dr. Shukin says, well, can I have a rough estimate? I like this individual. So yes, in the hundreds of dollars per month, I think it's a good estimate.
I think a better way to look at it is between $50 and $100 a day, right? That's really the easiest way, depending on what system you get. I think it's worth it. It's, spending a few dollars an hour on a new employee.
For the ROI, you're saying. For the ROI.
Yeah, well, no. Yeah. I think cost wise too, you could look at it that way, right? We're hiring an employee.
I guess that makes sense.
Right? It's like $6 an hour, right? I mean, that's a very good employee to hire them at that level. I see another question here about EasyVet. Well, this is a website I'm posting right now, Cubex integrations. You can see of the 19, I think we're up to 20 integrations we have. Do we integrate with the practice software that you're using right now? And to the question of Cubex Academy, I think I posted that link as well, Joey.
IDEX Neo, not yet. And if you're not happy about that, talk to our pals over at IDEX.
Please talk to the IDEX.
Yes. So Shepherd, yes, we answered that. Even though we don't use the invoice down here in the high volume spay neuter clinic, we really appreciate the time freedom that comes with Cubex. Oh, thank you, Savannah. We use a lot of the controlled drugs in a single day per patient, and it saved us hours of logging. We love this, and we love these. This is like a total record for questions. This is great.
It's great. No,
and
we're up closer to 30, by the way.
Have a DEA issue with the controlled reporting? Not that I know of. Steve.
Oh, certainly. Look, this is a very important question. So yes, you can certainly have DEA infractions with Cubex or any of these.
Yes.
Yep. So
yes.
So the DEA or any state licensing agent that comes in your practice is going to look for two things: an accurate inventory of what's in your controlled lockbox, and if there's any discrepancies with that inventory, right. So the key here is Cubex and any system is a protocol that you still have to follow, right? So if there's any kind of diversion, or if we are lackadaisical about managing discrepancies, then guess what? You're going to have a fine. However, Cubex makes it easy, and other softwares too, make it easy for you to log hub loss and waste and the things that discrepancies come from, right? So the key is having a process for those items that lead to the fines, and we help with that. And we can print out those logs instantly.
The best single thing you can do to reduce the risk of diversion and other DA issues is use the witness option. That's the single best thing you can do. We had a customer recently, an owner came to us and said, I had an admin, my manager stole fentanyl from my practice. And, this was a situation where, unfortunately, when you vest trust in a single person and they can do things by themselves, it's really hard to stop if you give that person a lot of authority. So the witness feature is there. It's a Cubex banner feature. Other systems have it too. You got to use it. Expiration tracking, as well as stopping people from opening 6 of the same type of pill. Exactly. That's another aspect of the container management. That's a real benefit. Had to miss the beginning of this, had a surgery. There is a recording. And Josephine, we can probably make that available to you if you would like us to. We'll look at that. Keep an up-to-date copy of the bin location report so you can still find items. Desiree, that's an awesome tip. I feel like you need to send us like an invoice for all these awesome tips you're giving us. But not really, actually. No, don't do that.
No, I'll take care of you though.
Okay, does it integrate video? We got that. We got the hurricanes.
I'll say Virginia saved so many hours with Cubex, keeping them compared to a manual written log. I think that's the key here is most folks think, well, the law is a written log, so Cubex doesn't fulfill that, right? Well, we can print things out and they're written, right? So
it's readily retrievable. That counts as readily retrievable under the CFA or the CFR rather. So it's fine.
And it's really the hours that we don't want to spend, right? And that's the key thing you're thinking about. When are you doing logs? Is it after hours when you want to go home? Is it someone doing it and thinking about having to get it done when they're focused on other tasks and it's taking up bandwidth in their brain, right? This is a critical piece of this is acknowledging that this is a task that we don't want to do.
So there are some people out there that sell hard copies of logs. Books that say, I don't know, is the Cubex log readily retrievable? It says it has to be readily retrievable. The Animal Medical Center in New York City, Blue Pearl, Ethos, Sage, NVA Specialty, all of these practices, not to mention half of the veterinary schools in America, all use Cubex. Do you think they would use it if it was not DEA compliant?
That's the question. And you know, that's a good indicator for the schools, Joey. Great point. This is where we're going, folks. Right? I mean, this whole talk.
Any vet under 35 has used a system like this, probably.
And there are many over, seeing that this is the way we're going. The industry is trending toward this way. So please, I know we're over time here. We're 5 minutes over. For those 65 of you still in the chat and learning, and thank you so much.
We're going to send a survey out asking what you guys thought. Steve and I would love some comments to show our mom at her 70th birthday party on Saturday. So the survey is going to go out on Friday. Let us know, good, bad, or ugly. Because she knows we're not perfect. She likes seeing the bad ones too. But whatever you guys thought, please let us know what you guys thought of the talk. Would you guys like to see more of this kind of education in the future? What kind of education would you like to see from Cubex? Thank you, Savannah. And we'll be happy to be in touch with more educational events coming down the line. Steve, anything else you want to add?
No, just thank you everyone for your time and taking that survey. That would mean a lot to us. And please make sure you follow up with us. If you have questions, we have a full team here of folks ready to help you practice. So thank you very much for your time. And thank you, Joey and Michael.
Thanks, guys.